Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Laura Rothfeldt, and she is the State Public Health Veterinarian at the Arkansas Department of Health. Dr. Rothfeldt, thanks for being here.
Thank you. Thanks for having me.
So we're talking all things rabies.
Yes.
Why are we talking about rabies today? Are you seeing those cases in Arkansas?
So we're not seeing human cases in Arkansas. I want to be very clear that we have not had a human case of rabies in Arkansas in over 20 years. The last case was identified in 2004 in Arkansas. Now, what we do see is a lot of potential exposures. And so we do have animal rabies. It's not rare, but it's also not that common. So we've seen this year, we've had 26 positive animals identified. The majority of those, actually 25 of those have been skunks and only one dog. But what we want to do is get the information out about how to prevent rabies in people, because sometimes there's a lot of miscommunication, misinformation that's out there. And so we're trying to clarify that and also make sure that people don't go and seek and get prescribed the treatment or the post-exposure if they don't actually need it. So there's a lot of different ways to handle a potential exposure.
So let's talk about that. If they are exposed, what should someone do?
So if they're exposed, and when I say exposure, that means either a bite or potentially a scratch. We think that a scratch is very minimal risk, but maybe there could be contaminated saliva. Then if they are bitten, then we need to determine, like, what were they bitten by? Where's this animal located? Can it be monitored or evaluated? And can it be tested? And so there's a little bit of time. We consider these not a true emergency. We consider these an urgency. And so what that means is that it doesn't need to be addressed like right that minute. Sometimes we have some days to even weeks sometimes to deal with and try to manage and figure out what information do we need to collect to make the right decision and do a risk assessment.
And miscommunication, as you said, is a lot. It's a problem.
It is. Yeah.
What are the most common things that are misconceptions within our community here?
Yeah. So the first one, I think, would be that there is a lot of rabies in people. I think that that's a big one. The other one is that bats are not a risk. We do know that bats do carry rabies, but it's also a small risk. So less than 1% of bats actually do carry rabies. It's actually more commonly found in skunks in our state. And also raccoons. So in our state, we haven't seen a case of rabies in raccoons in over 30 years, at least, if not longer. So we don't feel like they're a big risk. Doesn't mean that they could not get it, but they are potentially very low risk. And then the other thing is about treatment and getting that treatment right away. And like I said, you don't have to get treatment immediately, and you also have more time. So people want me to put a timeline on it. Like, it is out there that says that if it's over 72 hours or over 24 hours, I've heard even, then it's too late. And that's not true. You can actually get that post-exposure prophylaxis anytime up until symptoms develop.
So it is fatal, but not until symptoms develop?
That is correct. Okay. Yes. So it is a fatal virus. In fact, it's one of the most deadly viruses. The good news is that it's also 100% preventable. So if we can actually get a risk assessment conducted and get somebody treated within a timely manner, then we can actually 100% prevent that disease from developing.
So when you say prevent, is a vaccination? What does that entail?
Yeah, so it's actually a person that has been potentially exposed would get what's called human rabies immune globulin immediately, which is a fast-acting product that would help prevent the rabies virus at the time. And then they'll get a vaccine. They'll get 4 doses over 2 weeks. So that's a vaccination given on day 0, we call that, which is the date of the first administration, not the date of the bite. And then on day 3, 7, and 14, and all the information is available on our website. Previously vaccinated people would actually get a shorter dose. They'd get 2 doses 3 days apart, and they would not get the human rabies immune globulin.
Is it most common from bats? You mentioned that bats can have it, but what are the most common ways to get it? Like, what should Arkansans in our communities be? Is it skunks?
So actually for people, so skunks are the number one animal, yes, that test positive for rabies. But for human cases in the state, the United States, it is mostly bat exposure. Dog exposure, we haven't had a human case of rabies from dog exposure in many, many, many years. And part of that is due to the fact that we have done a huge vaccination campaign in our dogs and cats in the United States, and we've eliminated what's called the dog variant of this virus. So that means that if a dog gets it, it's spillover from another animal and it's not circulating amongst them like it is across the world. So globally, there's over 60,000 deaths of rabies in people, and that's mostly in children exposed to dogs in countries that have not eliminated the dog variant.
It is preventable, though. As you mentioned, what should we look for, think about in order to prevent it here?
Yeah, so prevention in animals is actually a good way to prevent it in yourself. So that's a huge public health win. So you're not only protecting the dog or the cat from getting rabies, but you're protecting, your children, your grandchildren, and yourself from getting it from them. Because, most people are not going out there hugging skunks and trying to interact with them. And so you want to protect it from the animals that you would interact with. So, any mammal, I do want to point out that any mammal can get rabies. And so the number 3 animal in our state that has, over the last 30 years, has actually been cattle. That usually takes people by surprise. So it's actually in domestic animals, it would be the dog, the cat, and then cattle. And that's really because they're out there in the pastures with the skunks, and the skunks are trying to spread their virus. And so they chase the cow, and then the cow gets curious and sticks her nose down there, or sticks his nose down there, and they get bitten on the nose, or they get bitten on the ankle or something like that. And the producer doesn't recognize that they have a wound.
And so what should a PCP look for in symptoms if they have a patient that they think might have it?
Yeah. So symptoms, once they do develop, they can take weeks to months actually after an exposure to develop. And so, but once they do develop, they start off really nonspecific. So it could be like flu-like. They may get a headache. They may start having some nausea and vomiting. But then it really is an encephalitis that it causes. And so they'll start to cause, they may become confused. They can become partially paralyzed. They can become disoriented. They may, end up in, going into a coma. A lot of times there's some anxiety, just because, it is really messing with the brain. And so anything can happen, but it is definitely progresses to a severe disease and into death.
But a person can survive after they've gotten it.
So after they've been infected, before they develop symptoms, so before it actually enters the brain, really, once it enters the brain, it is nearly 100% fatal. There's probably less than 20 cases across the world have survived, and that's really just through mechanisms of allowing the body time to heal and time to fight off the virus. And so they try to conserve the brain and put people into a coma and ice baths and things like that.
So what do you want the general public, but also the healthcare community, to know about rabies today? Is it something that they should be watching out with animals that are in their community, bites? What is the biggest important information that you want them to know? Yeah,
so the animal bites are the big thing, and we want those reported. And we want those reported so that we can follow up and do an investigation and make sure that both the animals and the people are getting the appropriate treatment. And we can do that from the health department standpoint. We can, facilitate observation of an animal, because for dogs and cats, we can observe them for 10 days and the person doesn't need to go through the shots, if that animal doesn't become ill during that time frame. So there's things that we can do. We can facilitate trying to get the animal tested for rabies. If you find a bat in your home, we want to make sure that you get that bat tested. So a lot of people do kind of throw the bat out. We'd rather have the bat tested. People may, shoot the dog and that does happen a lot. We can still test it even though the animal has been shot in the head. We can still try to test it. Even a frozen animal, we can test it. So there's a lot of myths that are out there. So we would like for people just to call us and ask us and not just make assumptions.
And that website, your website has the phone number and information on how to report it or request that information?
It sure does, yes. It's on the Arkansas Department of Health, and you can search rabies on the website, and has information on how to report a bite, how to submit an animal for testing, who to contact if you have concerns. for people and that kind of.
Well, thank you for being here and talking about rabies and all that you do for the community.
Sure. Thank you very much. Appreciate it.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.